Hello guys, welcome everyone to the new session. I am Dr. Tushar Kalra, MD third year PG resident in community medicine. So let's begin today's session on incubation period. First of all, we will see what is an incubation period. So incubation period is defined as a period between successful entry of pathogen and appearance of first clinical signs or symptoms of disease in an individual. So from a successful entry of pathogen to appearance of first clinical signs or symptom, we call it as incubation period. It is also known as intrinsic incubation period. The factors that influence the incubation period are virulence of the pathogen, infective dose, and susceptibility of the individual. Next is what happens when an agent enters the body. The pathogen circulates and reaches the target organ. It lodges in the target organ where it multiplies and reaches an optimum number. Now, after reaching an optimum number, it overcomes the host defense mechanism. It disturbs the structure and function of that organ and produces changes in the body fluid and body tissue. So ultimately what happens, health equilibrium is disturbed and appearance of first clinical sign and symptoms of the disease as we see. Next is here are some incubation periods and disease. So first one is the disease which are having very short incubation period. It is from few hours to few days. That first is food poisoning, bacillary dysentery, gonorrhea, meningococcal meningitis, cholera, etc. Second is the incubation period that varies from few days to few weeks, seen in common cold, measles, mumps, malaria, diphtheria, tetanus, pertussis, typhoid, poliomyelitis, yellow fever. Third is incubation period vary from few weeks to few months, as in amoebiasis, hepatitis A and B, Kala Azar and rabies. Incubation period varying from few months to few years is seen in tuberculosis, leprosy, filariasis, AIDS. Next is important terms that is related to incubation period. First is extrinsic incubation period. In the previous slide we have seen the intrinsic incubation period. So extrinsic incubation period is a period between entrance of pathogen inside the body of an arthropod till the arthropod becomes infective. So entrance of pathogen to arthropod becoming infective, that time interval is called extrinsic incubation period. Second is serial interval. It is the period between onset of primary case and appearance of the secondary case. Third one is generation time. It is the period between the onset of infection and maximum infectivity of host. Fourth is latent period. It is similar to incubation period, but it is used for non-communicable diseases. So what is it? It is the period between the initiation of disease and detection of the disease. Fifth one is median incubation period. It is a time required for 50% of cases to occur following exposure. Now last one is communicable period. It is the period during which reservoir is infectious to others. It can spread the infection to others. Now what are the uses of incubation period? So first one is making prognosis of a disease, tracing the contact or source of infection, for quarantine purposes, for immunization purposes, and for making diagnosis. Now here is some detail of incubation period. So first one is it helps in making diagnosis. So shorter incubation period as in food poisoning helps in making the diagnosis. Second one is it helps to trace the contacts or the source of infection. It is possible only when the incubation period is short, like in COVID. So we can trace the source of infection or contacts so that we can implement the control measures. And third is for quarantine purposes. So what is a quarantine? Quarantines mean limiting the movement of healthy person who are been susceptible to have been exposed to a communicable disease for such a period equal to its longest incubation period of the disease. So for the longest period of incubation, period of a disease, we quarantine that patient or a susceptible person. For immunization purposes, the at-risk person can be protected by immunizing after the exposure to disease by making use of the long incubation period, such as in rabies and tetanus. It helps in assess the prognosis. Shorter the incubation period, worse will be the prognosis. Example is tetanus. Here are my references.